Good afternoon, everyone. My name is Dr. Ansel Augustine, and on behalf of the National Black Catholic Congress, I want to welcome you to this webinar presentation. We're glad to have you with us today. Before we start the webinar, let us take a moment for a prayer. Next slide, please. Please join with me from your own residence as we pray together the prayer for healing for mental illness. In the name of the Father, Son, and the Holy Spirit, amen. Loving God, we pray today for those who are confronted by the sadness, ambiguity, and confusion of mental illness, and for those upon whom they depend for attention and compassionate care. Look with mercy on all those afflictions bringing them weakness, distress, confusion, or isolation. Provide for them homes of dignity and peace. Give to them understanding helpers and the willingness to accept help. We ask this through the intercession of Saint Dymphna, patroness of those afflicted with mental illness. In the name of your Son, Jesus Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Next slide, please. Here are some guidelines that I need to share with you before we begin our webinar presentation. This is a webinar, so you will be able to see the presenters, but you will not see the other attendees. At the bottom of the screen is a chat function that we encourage you to use to make any comments and ask any questions of the presenters. If you want to send a chat to everyone, change the designation to panelists and attendees. If you want to just send it to the panelists, keep the designation as all panelists. This presentation is being recorded, and the recording will be available on the National Black Catholic Congress website homepage within the next couple of days. So please share this important information with others. The last slide shown today will have a list of resources, which will also be placed as a link on the NBCC website with the recorded webinar. You may want to take pictures of the slides with your cell phones. A link to a very short survey will be sent to you by email after the webinar ends. We appreciate your feedback, so thank you in advance for completing the survey. Next slide, please. Now, it is my pleasure to introduce you to today's webinar facilitator, Dr. Tricia Bent-Goodley. Dr. Bent-Goodley is a professor emeritus at Howard University's School of Social Work and a graduate professor of public health in the graduate school. Dr. Bent-Goodley is a researcher and licensed clinical social worker with over 25 years of experience in mental health, administrative, and educational roles. Her research, administrative, and clinical career have included a special focus on addressing trauma and violence, with a focus on community-based interventions. She has developed academic and student support programs in her tenure at Howard, working to support the intellectual, social, emotional, and spiritual development of undergraduate, graduate, and professional students. A primary strength for Dr. Bent-Goodley is that she not only has a knowledge of trauma and violence as a researcher, but directly at the grassroots level through a career of developing innovative programs. She is proudest of being a wife and mother of 2 sons. Next slide, please. Our panel today includes Dr. Robert Wingfield, who is a licensed psychologist and director of behavioral health at Boys Town, Washington, D.C., where he provides outpatient behavioral health care to children, teens, families, and young adults. He is the author of several peer-reviewed journal articles and a book chapter addressing various topics, including childhood obesity prevention, childhood trauma, children's health development, and academic socialization. He earned his doctoral degree in 2013 from the University of Florida and received advanced clinical training as a postdoctoral fellow at Johns Hopkins University School of Medicine and Kennedy Krieger Institute. His clinical specialties include evidence-based treatment for anxiety, depression, attention deficit hyperactivity disorder, obsessive compulsive disorder, and related conditions. For over a decade, Dr. Wingfield has provided psychological services in multiple settings, including outpatient clinics, hospitals, a juvenile detention center, residential group homes, a university disability resource center, and a K-12 school. Next slide, please. Our final panelist today is Mr. Dwight Hollier. Mr. Hollier is a national board certified counselor and licensed professional counselor with extensive experience working with adolescents, families, and adults around a variety of clinical and non-clinical issues. Mr. Hollier is currently Senior Associate Athletics Director for Student Athletes Health, Well-Being, and Program Outreach at the University of North Carolina at Chapel Hill. Prior to that, he was Vice President of Wellness and Clinical Services for the National Football League, working in the Player Engagement Department, overseeing the Total Wellness Initiative. Mr. Hollier's mission and goal is assisting current and former athletes in achieving optimal wellness. During his time at the NFL, he has worked to enhance awareness and education around important psychosocial issues and has been a champion of reducing the stigma surrounding the help-seeking behavior of athletes. Mr. Hollier developed his passion for assisting individuals reach their maximum potential through his experience as an elite athlete. While pursuing his master's degree in mental health counseling from Nova Southeastern University in Davie, Florida, he played football for the Miami Dolphins. In total, he played professional football for 9 years, including a stint with the Indianapolis Colts. Thank you all for being here today. Now it is my pleasure to turn the webinar over to our facilitator, Dr. Tricia Bent-Goodley.
Thank you so much, Dr. Augustine. We appreciate you and all the things that you do to benefit us. Thank you, thank you, thank you. I would like to start by thanking the National Black Catholic Congress for having this important conversation on mental health and faith in the Black community. The Bible has so many references to the importance of the mind. For example, Romans 12:2 says, "Do not conform to the pattern of this world, but be transformed by the renewing of your mind." The Bible is so clear in reminding us of the importance and the uniqueness of our minds and our thought life. Family, way too often we, especially we in the Black community, stigmatize mental health. When someone says they're depressed, we might say, go ahead and just pray on it. Or when someone is behaving in a way or expressing themselves in a way that we're uncomfortable with, we might say, that's the devil acting in them. Or if someone has been prescribed medication for a mental illness, we might say, you don't need to take drugs to get better. I could go on, and I'm sure you've heard of these things and others. You may have even been the person saying some of these things. No worries. This is what our time together is all about. Learning, growing, and asking God to help challenge some of our perspectives on mental health and to create a fire in us to be champions of this issue in our community. As you can see, we are using the language of brain health and mental health interchangeably because the science has shown us how mental health conditions are connected to our brain. So this isn't something that's make-believe or just made up. We now know and continue to learn more about how hormones and neurotransmitters in our brains connect with specific mental illnesses and mental health conditions. This is in addition to genetic markers that have also been found to be helpful in treating and responding to mental health. This issue impacts so many of us. I know very few people who have not been touched at one time or another by mental health. Some things we know. 1 in 5 adults experience a mental illness in any given year. So think about your church community. Think about your congregation. 1 in 5 adults. Over 20% of children are impacted by a mental health condition, either currently or at some point in their lives. I'm thinking of the educators who are on, from high schools to colleges, some of our youth athletic leagues. 20% of our children are struggling with some form of mental illness or have. According to the Health and Human Services Office of Minority Health, African Americans are 20% more likely to experience serious mental health conditions compared to others. So this is disproportionately impacting our communities. We'll talk maybe a little bit more about why we think that's happening. A study done of national youth risk behavior found Black youth had, listen to this, a 73% increase. This is over the last 25 years. Black youth have had a 73% increase in suicide attempts. And they were the only group that had that increase. This is a serious issue for us. Another study on suicide deaths among 5 to 12-year-olds, and you heard me right, 5 to 12-year-olds, found that suicide rates for Black children were roughly 2 times higher than those of white children. And that number is largely driven by Black males, Black boys, Black adolescents. We have work to do. The needs around mental health have significantly increased since the coronavirus pandemic. And in some cases, we see certain mental health conditions tripling. Not to mention the social justice issues that have been visible, so visible and discussed in recent months. Can you see why we're having this conversation today? I couldn't be happier to be able to moderate this timely conversation with Dr. Wingfield and Mr. Hollier, 2 very distinguished colleagues that have contributed tremendously to the field of mental health. So with that, I'm going to get right to our discussion, our conversation, and our first question. Dr. Wingfield, you are a practicing psychologist in a large metropolitan area. How do you think the coronavirus pandemic has impacted what we're seeing in mental health on the ground?
You know, Dr. Goodley, the coronavirus has really caused a colossal impact in the mental health of individuals in our region, in our country, and in the world. And in my clinical work, I see it every day. It started quite early. We know that the virus became known mostly in mid-March, late March, and into April, May. And each month, each week, I noticed more and more reports of stress, uncertainty, anxiety. And these are a terrible combination of experiences to have because they all are related to mental health disorders. The more stress in a person's life, the more likely they are to start exhibiting some symptoms of a disorder. People experience a great deal of sleep disruption. We know the importance of sleep. If we're not resting our minds or if we're not resting our brains, this is going to have a deleterious impact on our entire functioning. And add to that, we don't even operate the same during the day because we're so in tune to the news. We want to know the next report on COVID-19, or we want to know the next CDC protocol for protecting ourselves. And we're constantly taking in information. This creates an information overload outcome. Our brains are not built to deal with so much in such a little small window of time. It is a colossal impact on mental health. This is a monumental moment in the field of mental health, as well as a monumental opportunity for our churches to come alongside the believers to engage them in a healthy dialogue on what to do. So I'm grateful to be a part of this panel. And there are more and more studies coming out showing that it's not just a person's fear of contracting the virus themselves. The fear is layered. People in one study in the Journal of Translational Psychiatry, a recent study, it revealed that the number one concern for a person is whether their family member would contract COVID-19. I find that to be very fascinating. The other concern was of unknowingly transmitting and infecting someone else with COVID-19. And then you get to the third fear, which is getting COVID-19 ourselves. I think that it speaks to the good that still resides in human beings, that in this study, people were first worried about their family members, then they were worried about unknowingly spreading it before they got to themselves. Then there's a cascading effect. The cascading effect is the stress of wondering whether your job is still going to be your job the next day because businesses have closed. And then on top of that, I'm a parent of two, a 5-year-old and a 1-year-old. We were one of many who lost childcare. Yet we still have 40-hour-a-week jobs, my wife and I. So we experience firsthand the stress that is involved with working a full day with normal expectations for productivity, but you have a 1-year-old and a 5-year-old walking around. I am a licensed psychologist. All of that knowledge all of a sudden became a little insufficient in getting us through. So even I had to rely on the supports of people and of course of our Lord and Savior Jesus Christ. But all of this is to say we are in a pivotal moment and we do need to have these discussions.
Thank you so much for that, Dr. Wingfield. And I think there are lots of folks who can probably relate to that feeling that you had with your 1 and your 5-year-old. No matter how much we know, man, those children can make us work at a whole nother level. So we all can relate to that experience and that thought. And just what you shared with us, how, you just talked about the layers of the coronavirus pandemic, right? And it made it clear to me that this is something that we're going to be dealing with. The impact, the mental health impact, is something that we're going to be dealing with for years to come, which makes this conversation for us even more important in the Black community. There are several stigmas related to mental health in the Black community. A lot of times people don't seek help because they don't want to be considered crazy, or they've been taught that what goes on in your house stays in your house. And so I really want to ask this question of you, Mr. Hollier. Can you comment on how the stigma of mental health stops people from getting help and what we can do to change it?
Well, Dr. Goodley, first of all, I want to say thank you for the invitation, and I'm grateful to have this opportunity to have the conversation with you, great clinicians, and to share this information. I think the topic is so important, and really appreciate the chance to be here. I'll say, as far as stigma in my household, when I was growing up, we didn't talk about mental health or health at all unless we couldn't stop the bleeding. Now, if you couldn't stop the bleeding, then we'd have to address it. But if it stopped, then we didn't talk about it anymore. And stigma has been a real challenge, especially for men, but also for women. And I've seen it, and I've experienced it in athletics. And so men are socialized to be these hyper masculine individuals. And so I'm going to talk about men in particular right now, just in the athletic space, in the space where I've spent a lot of my time. And when you grow up in that environment, when you're taught to suck it up, to brush it off, to push through, and don't let them see you cry. What are you crying for? when you hear that, or you hear, I'll give you something to cry about. And I think a lot of us have heard that. And I'm thinking, well, you just gave me something to cry about, which is why I'm crying. But when you hear that, when that's what you hear over and over again, it becomes your way of operating in the world, which means instead of talking through a challenge or using resources, you stuff it down. And ultimately that pain shows up in negative, destructive ways. For too long, Black men and Black women have been stuffing down their emotions and developing unhealthy coping skills. Being able to talk about emotions and feel understood is really freeing. And I think that's an important message that we should be sharing more broadly than this webinar, but across our pulpits, across our campuses. And I'm on a college campus right now, really talking about mental health. And the more we talk about it, the more we can reduce the stigma associated with mental health.
Thank you so much for that, Mr. Hollier. I think about, what you said in terms of how we just kind of stuff everything down. But you said it will show up. It will show up. And I think that's so important for us to just remember that those things that we stuff down, they're going to show up in one way or the other. And I think the other thing that you both have mentioned is the use of resources, and thinking about the importance of how we connect to different resources. So this brings me to an interesting question, because our churches are a resource. Our faith is a resource, right? In terms of how we manage some of the different challenges that we experience in our mental health. We know that there's a connection between faith and mental health. In fact, the Bible talks about this. The Bible talks about the mind and the spirit, right? It talks about the mind and the heart. It talks about our thought life. And so sometimes because of that, we might, as people of faith, tell someone to just pray on something, pray it away, pray away your depression, pray away your anxiety, pray away all that stress that you're holding on to. And I've heard people even discourage others, as I mentioned at the very beginning, to not take medications, because they think if you're taking medications, or if you're seeing a mental health professional, then maybe that means that you are lacking in your faith walk. So, Dr. Wingfield, I'm wondering if you can share some thoughts with us on this, and how we can be of faith and still use medication, prescribed medication, and still take advantage of counseling and supports that are available to us.
It is a fantastic question. It is a loaded question, but an important one for us to address. And I think that whenever the conversation of faith and medication emerges, I find it especially important to operate with tremendous amounts of humility, because we are each individuals on our own journey in this life. And I first think of us as citizens of heaven. Those of us who are believers, we're citizens of heaven first. So any plan in my mind should include prayer and scripture reading, so we can renew our mind. That is at the top of the list. I would caution anyone if the list stops there, because God has given us various forms of intellect and common sense, and these attributes that he gives us and these strengths that he gives us are just a small reflection of what he possesses. He is the superior intellectual. So we should engage our intellect on the journey of carving out the plan to address our mental health issues. And so God is good. We know that this is an attribute of God, and sometimes we may be able to see his goodness in a medical discovery that his grace has allowed to touch humankind. And so I think we may put people in a box, and an unhealthy box, if we don't allow the list of how they're going to address a mental illness or even a physical illness. If we limit it and we don't continue developing it. Faith and science are often put against each other when they don't need to be against each other. God is the author of nature, so he can be found in science, even scientific discoveries, but we ought to be humble and seek God's guidance, of course. Once we are connected to a professional who makes a diagnosis, we need to be humble to hear the treatment plan. That person went to school for X amount of years, feels like forever sometimes, to study the issues that the patient is going through and the things that they are experiencing. And they are using the collection of information gathered over the course of decades, maybe even centuries, to describe the best approach to handling the symptoms. And I love what Mr. Hollier addressed a few minutes ago. He used the word pain and he used the word stop the bleeding. And I do think it's important to bring those topics to the table whenever we're noticing a perceived dilemma. I think in culture, we sometimes embrace pain as this thing that's always going to cause us to grow. And Mr. Hollier playing in the NFL, I'm sure would appreciate this metaphor. When we're lifting weights in the gym, there's a difference between soreness because our muscles are growing and pain, which means we're probably injured and we need to take a break. We need to stop. And such is the case when we talk about mental health. There are some things that we are going through that are causing stress or strain to send us a message that we need to change a lifestyle behavior. But then there are times in which it has nothing to do with the person doing something wrong. It has to do with the way that they are created, the predispositions that are a result of this world not being perfect. So we're not going to have perfect bodies. We're not going to have perfect minds. And we should take everything to the Father in prayer, even those conversations we have with our professional related to whether medication is something that is a viable solution. So I hope that we don't shame people who are using medication. I hope that we are not judgmental of people who are using medication, because their decision-making process may include hearing from the Holy Spirit differently than someone else. We have our individual relationships with Christ. We have our individual health plans as well. So I believe it all comes together, and we don't abandon our faith once a medication begins, because no medication is a panacea. There still requires faith to believe that it's going to be effective, and faith is still required to have hope that the side effects are going to be bearable and that God is going to walk alongside of you in that faith and the insertion of the medication if it's warranted.
Thank you so much for that, Dr. Wingfield. I think one of the things that you highlighted for all of us is that this is, therapy, talking with a professional, it's a conversation. I think sometimes when people think about going to therapy or talking with a clinician or talking to, a psychologist, they're like, oh no, it just feels like, what do you do? And how do you, how is that going to feel? And what I like to tell people, it's a conversation. It is talking with someone who, like you said, has spent some time, some really concentrated time, understanding some of these dynamics, and has a readiness to be able to guide you and help you to come to some solutions or come to some answers or come to some peace, so that you feel like you can tackle what's going on in a healthier way. But it really starts at the point of a conversation. It's a conversation with a person who's not there to judge you, who is not, there to tell you what you should and should not do. It's a conversation. So I hope that helps folks who are thinking to themselves, what is that therapy process like? It's a conversation, folks, a place where you can just talk through what's going on for you without judgment, with a person who can guide you and is trained to guide you, through some of what your decisions and thoughts might be. I don't know if you want to add anything else to that, but.
It's 100% true. I'm so grateful for the chances I get when I'm talking to someone who has never accessed behavioral health care before or mental health care before. They're often nervous and on edge because they don't know what to expect. And there are plenty of cases that don't require a medication to go along with the cognitive behavioral therapy. There are occasions in which it is an important part. So there are a lot of people who don't want to get assessed because they might hear something that bothers them, or they might hear something that intimidates them. But the reality is you already are in the situation. It only makes sense to seek some expertise and get the conversation going. That's why I love when you said conversation, because ultimately it is an ongoing process. We are on a journey in this life, and sometimes we don't get the right barber when we go to the barber shop, and it just didn't work out. He didn't give me the right edge up, and I need to go to another barber shop, or I might need to go to another dentist if he didn't clean my teeth the way I wanted to. So we ought to be very careful in our process of this journey of taking care of our health holistically, to just be patient and not be afraid of the unknown.
That's so great. And I think, this brings me to a question for you, Mr. Hollier, because I know that you get to have lots and lots of conversations being on a college campus. As someone who's been on a college campus, I would always find that sometimes I felt like when parents would drop their children off to their campus, they were like, whew, okay, now there's somebody else who's going to be able to help my child, kind of manage this really tough time period in life. And we have a lot of folks listening to this webinar. They are at schools and universities and Catholic youth associations all across the country. So you have had a lot of work with this demographic of young people, especially. What should we be doing or saying to young people about mental health?
I think that is a great question, and it's so important in this moment. It's so needed, the conversation about mental health, and you talked about conversation. That is so important. One thing I did want to mention that Dr. Wingfield made a couple of triggering comments for me. One about the pain, of course, had some flashbacks there of some situations where coaches have made comments about picking yourself up and getting back out there. And then also, finding the right barber. Well, I had a moment where I had a good barber, and then I didn't. So let me stay on topic here. When you're talking about communicating to young people, we should be talking about mental health in the same breath that we talk about physical health. Mental health is health. It is part of your wellness, part of your overall wellness. And we know that when we talk about mental health, when we provide resources, we reduce stigma. We talked about stigma before. And ultimately, we see an increase in the utilization of resources, of counseling, of exercising, of community resources and communication that takes place there. We've seen in the college space that young people are more open to talking about and using mental health resources. but we have to make sure that we're providing culturally competent clinicians and resources when we're providing resources to those students and young people. And when we're talking about culturally competent, it doesn't mean that they have to be Black or they have to grow up where you grew up. It's not about that, but it's more about understanding the population that you're communicating with. And in athletics, there are a lot of examples that I've been faced with or that I've heard about regarding working with athletes. And again, the lens through which I look at things is through my athletic lens. So forgive me for always going back there, but that's a big part of who I am and a big part of the work that I currently do. And so, you know, when I talk about being culturally competent, you know, there's the story of an athlete who goes to a counselor and they're downloading about how difficult and challenging it is to be an athlete and to work on their athletics, and then also to be a student and the challenges that go along with that. And in the end, the clinician says, well, why don't you quit? You know, that's someone who is not culturally competent to work with athletes because they don't understand an athlete who is again downloading, talking about the challenges, are not looking to quit. What they're trying to do is work through those challenges and maybe even to get guidance on things they can do to better balance or manage those aspects. And so having someone that will listen, that will be part of the conversation, but come to it with the knowledge that they can be supportive and be helpful with that area, that particular young person or community that they're involved in.
Thank you so much for that. I think, gosh, you know, folks probably had never thought about the idea of cultural competence from that perspective, but thinking it through, you know, if you're working with athletes to have that cultural competence, if you're working with young men to be able to be culturally competent there, I think a lot of times we think specifically about cultural competence as connected to race and ethnicity only, but there's lots of different forms of cultural competence. And I just want to do a follow-up question to that, Mr. Hollier. I think there could be some coaches who are listening, and they're working with athletes day in and day out, or athletic directors who are managing athletic associations. Are there any things that coaches can say to kind of help athletes around mental health?
Absolutely. I think one of the most powerful things that coaches can do is to take advantage of I'll call it power, the power they have, the influence that they have with young people. And this could be about mental health. This could be about spirituality. It could be about healthy manhood or being a good leader. And it's advice that I got from one of my mentors, Tony Porter, with A Call to Men. And he said, you know, when a coach is having a conversation with young people and he got all these young people on one knee and leaning on every word that coach say, wouldn't it be a great opportunity for them to say something about something other than sports, to talk about something other than sports at that time? When you have their attention, they're leaning in, and coaches have a tremendous influence. So educating themselves on mental health, and getting to a point where they're comfortable having that conversation with young people, I think would be really, really powerful.
That would definitely be really, really powerful. I hope that folks who are out there and have that influence to really think that language through. And guess what? Last month we heard from Tony Porter, so they can listen to last month's webinar and get some even more additional information about the context of that conversation that came up in September's webinar. So thank you for that, Mr. Hollier. You didn't even know. It just worked out that way. So that was great. Yes. So I think this brings us to some really interesting questions, because sometimes we find that folks may, they may not know when they need help. Sometimes you don't know that you might need to get some support. We're not always clear about the signs or the symptoms that indicate that we might actually need to get some support for our own brain health. And so, Dr. Wingfield, how do you know when you need to get help? Are there certain signs that we should be looking for? How do you know when it is that you might need to reach out and get some support? What signs should we be looking for in ourselves or in the people we care about?
This is a fantastic time to just even have a self-reflection in this moment as we're in the midst of this broadcast and this webinar. Our bodies are doing something even as we sit here. From our toes all the way up to our head, our body is doing something. If we just take 5 seconds to just not do anything but pay attention to the muscles in your body, I won't say anything for 5 seconds. We're going to come back together. If we did more check-ins each day, we would be more in tune to the signs and the symptoms that something is off. When a person studies to work for the bureaus that control the production of money, they familiarize themselves with the they familiarize themselves with the authentic money. So if they come across a counterfeit, they can readily tell the difference. So we need to understand when our bodies shift, that's a counterfeit version of who we are meant to be. That's not the real person we are meant to be. Something is off. This isn't the authentic person I'm supposed to be. I'm supposed to be healthy. I'm supposed to be productive and functional. We need to get in tune with our bodies. And Mr. Hollier, already talked about how mental health and physical health too often get separated out. And we need to just think about this as a health mission in general. And I love those meditation approaches. Someone in the chat talked about what's a specific coping idea. Well, meditation. Because when you do the meditation, you could get the opportunity to do things like body scans, where you're just scanning your body to find out where the stress resides. Some people hold stress in their feet. Some people hold stress in their neck. It's amazing the parts of our body where we can hold stress. Some people have twitches in their face or their bodies when they are under stress. Stress will typically lead to a couple of different things. Restlessness. For some reason, you just can't be still and just take life as it's coming. It's difficult to even fall asleep. So we often see sleep disturbances in people who are having early signs of a mental health problems with the sleep. Now, this is a cruel problem because once you have a sleep issue, you probably are not getting 8, 9, 10 hours of sleep anymore. You might be down to 5 or 4 hours of sleep. A sleep-deprived person can present with a whole host of mental health problems just because their sleep is off. Irritability. People who can no longer tolerate even a child's age-expected misbehavior is showing something's off. That 2-year-old is not being crazy. That 2-year-old is being 2. And we may see overreactions in a caregiver because they are no longer able to process this reality that a young child, for example, deserves some patience and some leniency. There are signs that may, you know, in disorganization. A person is less organized than they typically are. You usually see a person who's not able to hold it all together. And when you see this in yourself, it's easy to go into defense mode when somebody brings it to your attention and want to make excuses. But all those excuses are delaying the opportunity to meet with a professional to get some solutions in place. So if this is what a person maybe attending this webinar is going through, there is no shame in going to a family member the next step and to ask, have I seemed off lately? I feel off. I don't know what it is. What have you seen? Now you have the advantage of multiple perspectives, because in life we have to recognize that we have blind spots. Just like when we drive our car, we think that it's clear to switch to the right lane. There's a car there, we just don't know it because the side view mirror didn't show it, but the car is indeed there. We need to make sure we understand that we have blind spots. So we should maybe do a monthly check-in or a weekly check-in to ask a friend, a family member, a spouse, how have I seemed lately? And they might ask, what do you mean by that? Well, just in general, my behaviors, my habits, my tendencies, and then the conversation can go from there. And the word conversation keeps coming up, because this isn't really a situation where we're going to issue every family in America a checklist. I wish, but it's not practical. We should make this a standard part of family conversations, just to check on each other's mental health at the dinner table or in passing in the kitchen. And I hope that people walk away knowing that this isn't super complicated. It's not it's not rocket science, so to speak. It's uncomfortable. It's uncomfortable to ask for feedback because we think we can't take that feedback. We might have an insecurity that if they say something that I don't want to hear, I won't be able to handle it. But we know from scriptures that the Lord will give us strength if we ask, even in this feedback moment. We might need to do a prayer before that feedback moment. Lord, I don't know what my friend is going to say about my health, my mental health over the past month. I don't know what my family member is going to say, but give me the strength to take that feedback, that constructive critique. Give me the strength to take it. And I think that at some level, each person in the world should be able to relate to some of this, even if it's just a little bit.
Thank you so much for that, Dr. Wingfield. I think just reminding us to be open to hearing what folks see in us. And then you mentioned just slowing it down sometimes. It's so hard for us because we're all moving at warp speed, but slowing it down enough to be able to know ourselves. And the way we'll know ourselves is how often we are checking in with ourselves to see how we're doing. And then you gave us a number of signs to look for, from changes in our sleep pattern to changes in how we're eating, or someone who might be feeling irritable, or maybe that's being expressed as anger. Folks who might feel sad or have excessive worrying or fear or shifts in mood. Somebody who might be withdrawn. So you've given us a whole lot to think about, to look for in ourselves and others. But as you said, it starts with really us doing more of those check-ins with ourselves and seeing the people in our lives. I want to note Father Thorne's comment in the chat about the young man who was killed in Philadelphia, who had mental health issues earlier this week. And our hearts, of course, and our prayers are all going out to his family and to the Philadelphia community. And I think it really does speak to, yes, Brother Walter Wallace Jr. I think it really does speak to systems, right? How systems begin to build mental health responses. And a lot of times people want to start the conversation around mental health, but they may not know how to go about doing that. I'm going to direct this question to you, Mr. Hollier, because as was said in your introduction, you have done this in one of the most notable brands in the world, in really being able to create progress. And I've seen you do this firsthand, to bring progress around conversations of mental health in the National Football League. Now you're in one of the largest athletic programs in the country, and you're continuing to do that and advance that conversation. So if there's someone who's listening and they want to build their mental health infrastructure, maybe in their church or in their community, what do you think they should be doing or saying in order to begin to get that work done?
Well, thank you for the question. I think, one, I will admit that I've had a lot of support along the way in doing some of the things that we've been able to do. And I certainly can't take a whole lot of credit for that. I think one of the first things to do when you're trying to figure out what you need, particularly as it relates to finding mental health resources, is to assess what you are already doing. Assess the supports and the mental health supports, and they can look a lot of different mental health and wellness supports that are already in place. A lot of what congregations are already doing are serving the needs, the mental health needs of their congregants, and there are also resources available to serve neighborhoods. So what's already available to you? What are the mental health resources that are already available to you? Who is in your congregation or in your neighborhood who can volunteer their time and expertise if they have a mental health or wellness expertise to help support the community? What are the local community programs that provide clinical and other mental health supports? So really taking a step back and looking around to see what's already in place, and leaning on those resources and those people that are already there in place that you may not have thought about because you weren't focused specifically on mental health and the mental health resources. When I was at the NFL, I leaned on the 32 NFL communities to help identify resources for those teams in those communities, and finding, I talked about being culturally competent. Well, being culturally competent also means understanding the surroundings that you're in, and being based in New York, where I was in the league office. I didn't understand what the community of Baltimore needed, or what San Francisco would need to work with their team and their community. And so I leaned on expertise who are already in place there. Some of the resources that I looked at to assist was, Cigna Behavioral Health, the Black Psychologists Association, Psychology Today, the National Board of Certified Counselors, which is the other NBCC that's out there. So Mental Health America, NAMI, the National Association of Social Workers, like all of these resources had people in different areas of the country that I could lean on, that I could pull resources from, that had already established themselves in those communities. So again, I'll come back to the question and say, identify the community resources that are already in place. Identify the neighborhood individuals and resources that are already in place. Identify the clinicians that are part of your congregation that can be supportive to your congregation, who are the wellness gurus that you already know and can identify. And if you don't have those, then looking at some of the resources that I talked about, but that we'll also share, some other resources that are available to you. And I'll also say that I had an amazing network of powerhouse clinicians, including Dr. Goodley, that I leaned on for guidance. They are all a lot smarter than me, and have been great to have that cushion that I could lean on to help support me in my roles that I've been in, and it's been amazing to be able to connect with those kinds of resources personally.
Thank you so much for that, Mr. Hollier. And I mean, again, so nothing happens without having that leader and that champion. And so you've done that and been that to lots of organizations. We're grateful for that. I think it just speaks to just the importance of our voices being a part of this conversation. And I want to say, especially for Black men who are doing this work in our communities and at varying levels of practice across the country, that's so needed and so critical. I shared at the beginning that we're seeing numbers of suicides increasing in the Black community, particularly around or among Black boys and Black men. This is something we hadn't seen before. And so I wonder, Dr. Wingfield, if you might share what are some signs for risk of suicide, and who should you contact if you think someone could in fact hurt themselves? And I want to note, we see the comments in the chat section. We will have time to talk through some of the questions you're posing and to share some of our ideas. But Dr. Wingfield, what signs should we be aware of in terms of suicide prevention?
With suicide prevention, Dr. Goodley, one of the things researchers discover is that more focus on the precursors to suicide will help in the prevention efforts of suicide. So precursors to suicide often are trauma, depression, and anxiety. If we get better as a society, as a people, catching those signs of trauma, depression, anxiety, we can stay ahead of the devastating outcome of a suicide. Even a suicide attempt can cause a lifetime of injury for the surviving person. Isolation is often seen in a person who is in that space. The world is negative to that individual, so they are less motivated to have their normal interactions and contact. So I would definitely want people to pay close attention to the links that will be available as we progress through this conversation today. And there are a number of resources that I scanned through earlier that give direct access to hotlines and phone support. The organization I currently work for, Boys Town, is a national organization. They happen to have a Boys Town in Washington, D.C. I do direct a behavioral health clinic there. Thankfully, there is a 24/7, 365-day phone support for crisis calls. I think the last time I looked at the stat, they take over 2 million calls a year. And they even have text message support. This is fantastic. A lot of people are in that space where suicide is on their mind. They might not have the energy or the motivation to make a phone call, but they will send a text message. In behavioral psychology, we call this behavioral momentum. If you send a text to this person who's trained and certified in suicide prevention, that's one step forward. And this often creates the momentum to then have a phone call. So technology is catching up to the way that people communicate, and we should take full advantage of getting more and more information out there related to these text message options to access this free support. And the specific entity I'm referring to in the department is the Boys Town Access Hotline for crisis response, immediate support. And there's also a more national funded version of this, but this is just one organization's attempt to respond to the community and the nation's need for more immediate counseling services and to get referrals as a result of these calls, because some people are not connected to a provider and they're having these suicidal ideations, suicidal thoughts.
Thank you so much for that, Dr. Wingfield. Again, some of the resources that we are referring to, you will find at the end of our presentation today. I want to highlight again some of what you mentioned, Dr. Wingfield, things for us to be thinking about. I guess I would say to you folks, listen, if someone tells you they're thinking about suicide, take that seriously. I think sometimes people say things we sometimes don't take what they're saying seriously, but if you say it, if they say it, take it seriously. If they're getting affairs in order, pay attention to that, right? Like if they're planning on some things and trying to put some things in order, or if they have a plan, or if they have a means, these would be all things that would make me say, I'm calling that National Suicide Prevention Lifeline. Or maybe I can put the person in touch with them, or maybe we can do it together. But do not hesitate if someone has brought this up to you. There are lots of resources available. I do want to, before we move into the question and answer period, want to mention Mental Health America. If any of you have followed Mental Health America on social media, you'll see they've been talking so much about mental health, particularly during this time related to COVID and what we're seeing happening around police brutality and social justice issues in our community. Mr. Hollier, you serve on the national board for Mental Health America. So I wonder, can you share maybe some information about Mental Health America with our participants, our audience, just so they can learn a little bit about this organization and what it does?
Sure. Mental Health America, the National Mental Health America office, they also have affiliate Mental Health America offices all around the country that work to provide education, resources around mental health. They are on Capitol Hill trying to advocate for mental health changes in laws and rules to help be more supportive of the mental health community. It is a really strong organization, and they do a tremendous amount of work, provide a tremendous amount of resources and education, and their website is filled with a lot of information that can be helpful, particularly in this time, as you mentioned. One of the resources that I think is a pretty powerful resource is their screening program. So MHA's screening program is available to anyone with the internet, with an internet connected device. The program provides access to 10 validated mental health assessments that are all free, anonymous, and confidential. And they can be found on the MHA website, or you can go directly to mhascreening.org to get to that. To date, 6 million people have completed screenings. Over the course of the pandemic, screenings for depression increased by 700%. Anxiety screens increased by 500%. It's important that we are taking time to really look at and assess where we are. And so the great thing about the assessment tools is that if you do one of these individual assessments and your findings put you in a severe category or even a questionable category, they have online counselors who are ready to have a conversation with you, and will send you a message right there on the screen as you're finishing that particular screening. They have information for Black and Indigenous people of color on their website that I think is really powerful information. Mental health stats related to African American communities. Again, you can find all of this information on the MHA website. Just looking and scrolling through, it is one of the big things that they do too is public education, and they have campaigns every year, especially around Mental Health Awareness Month in May, and this past year's focus was on tools to thrive. So really focused on the pandemic and how do you thrive, and all of this information, mha.org/May, you'll find the materials for tools to thrive. For the BIPOC Mental Health Month, you'll find that mha.org/BIPOC. Back to school information, again, there's a tremendous amount of resources that's there. It's a great organization, and really provides a lot of support and resources for all communities.
Thank you so much for that, Mr. Hollier. I really appreciate it. I think, again, these are just great resources for us to be aware of and to be able to utilize. We do have a number of questions, and I really want us to be able to get to each of them if possible in our remaining time. So I want to thank you both, transition over to Q&A, and also say thank you to those who submitted questions. I want to thank you for the courage of asking a question around this topic. We really do appreciate it. So one of the first pieces I'm going to read, and I'll ask Dr. Wingfield or Mr. Hollier, whoever wants to respond, either of you or both of you, whichever would like to respond to this. My child OD'd last night. He's now being evaluated, but needs a counselor or a residential program that would address his mental illness of depression and anxiety. I'm afraid he may succeed if he doesn't get the right help. Staying at home has not worked time and again. We have to admit we are exhausted, and he's tired of fighting off depression and anxiety. Any thoughts on what we might tell this participant in terms of how to respond to this?
Well, as a professional disclaimer, I always must announce that in these kind of forums and situations, I'm not responding to a specific individual because I'm not treating the person. I don't know their assessment history, and I have to speak in general, universal terms. In universal terms, it is very important to align any person to the right level of care. The last thing we'd want an individual to experience is a step down that's too drastic. Any person who's being monitored 24/7 then goes to a non-monitoring scenario. We must ask questions as family members. We must ask questions about what's in between. And there are all types of levels of care, and I'll just describe a few. You have inpatient care, which is the most restrictive, and the most monitoring is occurring because there's 24/7 monitoring of this individual who's in a ward or a unit, a psychiatric unit. Then you have a partial hospital experience where a person might go to a treatment experience Monday through Friday from 9 a.m. to maybe 4 p.m. And they're there for maybe 2 weeks. They go home at 4 p.m., for example. And then you have another level down, intensive outpatient. Intensive outpatient would maybe mean 2 or 3 visits a week going to an outpatient center, and then you have weekly and monthly. All too often in the field, I've noticed people who don't get the right level of care. So I encourage anyone out there to have these questions ready and available. The best advocate is the family member The individual who is, going through the suffering experience might not be able to hear, might not be able to take everything in. The family member should take notes and have poignant questions for the provider and look carefully at any recommendations on the discharge summary. And don't be afraid to challenge a decision respectfully. If something doesn't make sense, ask questions. And just in general, access to care is important. Insurance plays a role in whether a person is able to be serviced. So making sure you understand the information that's available on the insurance websites. The insurance websites have tons and tons of information, and you can communicate with the customer care to make sure you are clear about the benefits that is a part of the policy. And these are technical questions that could bore us, but they're important because they can present barriers if we don't understand them. So we must be highly engaged in the intellectual part of servicing someone or helping someone. As we know, the sympathy will be high and the compassion will be high. We also need to be highly intellectual and sophisticated in how we address the plans that people give us. So I hope that can be of some help. And there are resources. If a person lives in DC, the Department of Behavioral Health of DC has a website that has a listing of the agencies and the clinics that are available to take someone, even if it's a Medicaid. And then you have the departments of behavioral health in counties like Prince George's County, where you can access information on that website as well. The key is to layer your calls. So you can get on a couple of different wait lists at a couple of different clinics and just, get a feel for which location seems to be the most responsive and have the best services based on maybe information you can read on the website.
Thank you so much for that, Dr. Wingfield. And also thank you for that reminder of just, we do have to reiterate, we can't give any mental health specific advice for individuals, but hopefully the answers will help you in your thought process. But we do want to just connect you again to resources. I did put in the chat, and you will see later, NAMI, which is a wonderful resource. The phone number, you'll see that it's in the chat. I'll put it in for everyone. They also have a text feature, so you can text them after hours. So that's another great resource. And I wanted to mention, because this person, the participant, shared, as parents, sometimes as the people in the lives of someone who is working through mental illness, it can be pretty taxing on you. And what I like about NAMI is that there are resources available for those of us or those who care for persons who have a mental illness. Okay, so please make sure that you all are taking care of yourselves as you take care of others, right? We cannot pour from an empty cup. So it's really important to make sure you're doing what you need to do to take care of yourself. NAMI has some good resources there. And then also, getting your own therapist or clinician who might be able to work with you. We had another question. What do you do in a situation where maybe you have a child and they don't want to take their medication because it makes them feel spacey, or, they just don't feel comfortable taking the medication? Are there any thoughts that we can offer in situations where a person just may not want to take the medication they've been prescribed? And this might line up again with just us not giving specific mental health advice. But just in general, are there any thoughts about what happens when folks just may not want to take the medication? How can we be supportive?
I'll respond briefly to that. That is a common occurrence, unfortunately, where people have the authority to say ultimately whether they're going to follow a treatment plan or not. And it's important, if you are a supporter of someone like this, connected to them, to not engage in anything that will enable that potentially reckless decision. and sometimes that's the best that we can do, is to make sure that we are not enablers, allowing this seemingly poor choice for a person to do something against medical advice. Make sure that we're not enabling or not enablers. And every case is so different. But that's the best piece of thought I can give right now.
Thanks for that. And I think, again, just really connecting with someone in your local community, just to let you know, similar to medical doctors, for mental health clinicians, they are licensed in particular places. And so that'll be important for you to be talking with someone who is a licensed clinician in your state, who could help work through some of these different pieces with you. And that's why I like the resources that we're going to share with you. There are national resources where you can connect to potential sources of support and information that might be available. And I know our presenters actually said this. You know, if you find somebody and you don't feel comfortable with them, it's okay for you to look for someone else you do feel comfortable with, right? So it's all right. And we got to plan for that. We've got to plan for that, but we can't say, this is hopeless because I didn't find the person I picked didn't work well with me, right? There's always, you know, there's somebody who might be a perfect fit for you. It may take you a minute to find the person, but they're certainly available. And so I think that's super important for you to make sure that you're connecting to the resources that we're going to provide at the end of the webinar. We have another really great question, and that is, are there any recommendations for the religious who are not trained in mental health, but who often encounter folks in their parish who are more comfortable talking to them than a mental health professional? So what happens when you are that priest, that deacon, that sister, and you know, folks are coming to you with mental health questions, but they're not really willing to or comfortable with talking to a mental health professional, and you're not necessarily trained to deal with that? What kind of thoughts would you give to someone in that situation?
Well, I can't speak to you know, working with clergy, but you know, again, the lens that I look through things is my athletic lens. So one of the gatekeepers for us in athletics are athletic trainers. These are folks that work with the individual athlete and helping them when they're injured, rehabbing, getting back to work. And so they have intimate contact with the athlete. And oftentimes they hear it all. They hear the good, the bad, the ugly that athlete is dealing with. And one of the ways that we've helped, and they've come with a similar type of question, and one of the ways that we've helped them is to provide an educational module called Mental Health First Aid. And mental health first aid, it's not training them to be a clinician, but it is providing them information to be able to have conversations and even advocate for that person to get to the resources that they need. It's a really good resource that I think would be beneficial for leadership to invest in for their parish.
Thank you so much for that. Go ahead, Dr. Wingfield.
That's an excellent point, Mr. Hollier. I wanted to add a thought. There are some universities, let's just say the Catholic University of America, they are training advanced graduate students in the area of mental health. And universities can be especially generous with their time, providing access to a graduate student who can be highly skilled and supervised by a person who might be licensed or more experienced. Being creative in these situations sometimes is necessary, I would recommend reaching out to a university to see if there could be some free professional development to almost complement what Mr. Hollier said, um, educating the layperson, so to speak, or the clergy member on some key fundamentals to be of more support, and that's something to look into.
I love that. Thank you so much. And I just put into the website there, mentalhealthfirstaid.org, so you all can go there. Dr. Wingfield brings up your local colleges and universities, another great resource. And let me throw out a couple of other things. You know, we have the power to do a lot to help create dialogue around this topic. So if you find that you have parishioners who maybe are not comfortable talking to a mental health professional, maybe part of the process would be to grow that conversation. So for example, have an event at the church where you talk about mental health. Bring a mental health provider in to have some of those conversations. Have a fair where you have, you know, a health fair around mental health. And I know a lot of folks are saying, but you know, right now with COVID procedures, we can't do that. You can do it via Zoom. You can have some type of a mental health event where you're introducing mental health, just like what we did today, with local providers in your community. So you're kind of saying, hey, parishioners, this is a resource and I want you to use it, right? You can put information in your bulletins. Put some information about mental health in your bulletin. Put information about mental health providers in your bulletins. That's another great way to say, this is good, this is okay, I want you to reach out. And if you feel like you have that knowledge or awareness, you can even say within your homily as you're talking about the importance of utilizing some of those resources, in addition to using the resources of the religious. Another piece is to partner with or get to know. There may be mental health providers who also specialize in the intersection of religion and mental health care, right? So there's a lot of providers who have that training and orientation so that the person can begin to get the integration of mental health and spirituality in the work that they're doing. So those are just some additional examples of things that you can do to sort of help build that bridge for folks in our parishes. I did have one other question that was in the panel before we get ready to close out. I think this will be our last question, and then Dr. Augustine will come back and be as wonderful as he always is. But one of the questions in the end of it, it talked about triggers, right? Really understanding what are some triggers that people might want to think about as it relates to mental health. I think this is super important because we have holidays that are coming up. Sometimes holidays can be a trigger for folks. The holidays this year might look a little bit different, so there could be triggers in that space. We know that it's about to get dark earlier, and so some folks are affected, by that. And so I wonder, Dr. Wingfield, Mr. Hollier, as we get ready to close out, any thoughts or questions about how people can identify what their triggers are, especially as we go into this really interesting holiday period?
There's a particular branch of psychology. The name of the modality is acceptance commitment therapy. In acceptance commitment therapy, there is a term often used. The term is experiential avoidance. That is the avoidance of an internal experience. Nobody else can see this experience because it exists in your thoughts. We often see this as a trigger in the field of psychology because if the person can't even fathom or deal with the thought, they certainly will struggle to deal with the physical equivalent of it. So if there is a person who passed away and the individual can hardly even think about that person who's now deceased if they see a photograph of this person at a family member's house over Thanksgiving or Christmas, this will likely create a strong reaction, a negative reaction. My point is, we should be really mindful of our thought life and help people to be mindful of like how their thoughts are affecting them, especially leading up to the holidays and anniversaries of events. If I'm not mistaken, next year would be the 20th anniversary of 9/11, of the Twin Towers going down. And I can only imagine, I feel horrible for people who are still in that journey of recovering from that. 2 decades can feel long, it could feel short. But even with that milestone, that 20-year milestone, you will have people react strongly to it. So we have to maybe even look at our calendars to just figure out what are the dates in this calendar that stand out to me in a way that's bothersome, so I can do some planning ahead of time to make sure I'm extra prepared mentally, emotionally, spiritually for this time of year. Dr. Goodley alluded to something that may be real for some people, even in this webinar, seasonal affect disorder or experiences, where when the sun goes down earlier, people start to show more signs of melancholy, more sadness, because this is a real phenomenon in which we benefit from the sun, and some people are more sensitive to when the sun is not out as long. So this can be a very layered type of experience and phenomenon, and talking about it and being sensitive to our reactions to the thought will help us to understand the reaction to something in the concrete, visible, tangible realm.
Thank you so much for that. I am really just so filled, full with the discussion today. And I really appreciate both of you, Dr. Wingfield, Mr. Hollier, for giving of your time this afternoon. We really do appreciate it. I hope, you all have in some way been moved or touched to be champions around mental health in your parishes, in your, Catholic youth organizations, within our high schools and our Catholic universities, and just for all who've been able to be here within your communities. I mentioned mental health first aid. You can bring that to your church. You can bring that to your parish. You can bring that to your school. How about that? They have mental health first aid programs specific for youth. So there's so many things that we can do. And this is a really important time to do it, because we'll be looking at these issues for many, many years to come, especially because of what's happened and transpired in 2020. So I just, again, want to say thank you to you two wonderful men, wonderful champions. We are so grateful and so blessed that you two do the work that you do in our communities. So we thank you. And thank you again to the National Black Catholic Congress. And I will turn it over to the great Dr. Augustine.
Thank you again, Dr. Wingfield, Mr. Hollier, and Dr. Bent-Goodley for this wonderful conversation. No doubt that the knowledge shared today will positively impact our attendees and families, and we're hearing some of the praise in the comment box now. Thank you again to the panelists for taking your time to be with us. I also want to thank you, all of our attendees today as well, for your participation. Next slide, please. But at this time, I think we have all been presented with a call to action. For us, our call to action is this: discuss mental health and mental illness in a non-judgmental way. We need to take away the stigma of mental illness. Ask someone how they are and take the time to listen to what they say. And just as important, how they say it. Place mental health and mental illness pamphlets and materials in your home, office, and with your pastor's permission, in your church, preferably somewhere where they can be taken discreetly. And then prayerfully consider what is in your heart to do. And as you see at the bottom of this slide, for immediate help, call 911 or the National Suicide Prevention Lifeline. Next slide, please. Here is the contact information and resources that are available for you to learn more. As you know, or take pictures of the resources on these slides, there are some items that I would like to reiterate. First, the webinar was recorded, and the recording will be available on the National Black Catholic Congress website homepage, along with these links to the resources by the end of this week. You will also receive a quick survey by email shortly after this webinar ends. The National Black Catholic Congress uses your feedback to help construct future webinars, so we appreciate your help. As this next slide loads, on behalf of the National Black Catholic Congress, I wish to thank everyone for joining us in this important